Disclaimer, I am not now, nor have I ever been any type of doctor. I am just wanting to bring awareness to mental health and illness through illustration. This week, I'm going to be illustrating Dependent Personality Disorder, or DPD. Dependent Personality Disorder is an anxious personality disorder characterized by an inability to be alone. People with DPD develop symptoms of anxiety when they're not around others. They rely on other people for comfort, reassurance, advice, and support. This condition results in submissiveness and clingy behavior, or a fear of separation and difficulty making decisions without reassurance from others. If you have ever felt like this or have dealt with feelings of insecurity, it is not likely that you have this disorder, as people with DPD need reassurance from others in order to function. DPD appears to occur equally among males and females, and signs usually first appear in early to middle adulthood. People with dependent personality disorder are oftentimes characterized by pessimism and self-doubt, tend to belittle their abilities and assets, and may constantly refer to themselves as stupid, dumb, or anything of the like. They take criticism and disapproval as proof that they're worthless, and they lose faith in themselves. People with dependent personality disorder need to be taken care of and are extremely anxious about taking care of themselves. To get the care they want, they are willing to give up their independence and interests. Because they think they can't take care of themselves, they use submissiveness to try to get people to take care of them. People with dependent personality disorder tend to interact socially with only the few people they depend on. People with DPD may require constant reassurance. They can become devastated when relationships and friendships are severed. When a close relationship ends, people with this disorder immediately try to find a replacement. Because of their desperate need to be taken care of, they may not be using the best judgment when choosing a replacement. People with DPD might want overprotection and dominance from others. Their dependent behavior is oftentimes seen as being clingy because people with DPD fear that they cannot live their lives without the help of others. Some symptoms of dependent personality disorder include an inability to make common everyday decisions without the reassurance of others, avoidance of personal responsibility, including tasks requiring independent functioning, avoidance of adult responsibilities by acting passive and helpless, dependent on a spouse or a friend to make the decisions like where to live or where to work. Intense fear of abandonment and a sense of devastation or helplessness when a relationship ends. Difficulty being alone. Avoidance of disagreement with others out of fear of losing their support or approval. Willingness to tolerate mistreatment and abuse from others. Placing the needs of their caregivers above their own. Oversensitivity to criticism. Pessimism and a lack of self-confidence, including a belief that they are unable to take care of themselves. And difficulty beginning projects. Causes of dependent personality disorder are unknown. There are usually some signs or symptoms that may present themselves in the beginning of childhood. Chronic physical illness or separation anxiety disorder in childhood or adolescence may predispose an individual to the development of dependent personality disorder. A diagnosis for dependent personality disorder is made by a mental health professional, as family physicians and general practitioners are generally not trained or well equipped to make this kind of psychological diagnosis. The treatment goal for people with DPD is to increase their self-confidence and help them feel they have the ability to act independently of others, yet maintain close and meaningful relationships. Psychotherapy, a type of counseling, is the main method of treatment for DPD. Short-term therapy with specific goals is preferred when the focus is on managing behaviors that interfere with functioning, as long-term therapy could put someone with DPD at risk of growing dependent on their therapist. Specific strategies might include assertiveness training to help the person with DPD develop self-confidence, and cognitive behavioral therapy to help someone develop new attitudes and perspectives about themselves relative to other people and experiences. Medication might be used to treat people with DPD who also suffer from related problems such as depression or anxiety. However, medication itself does not usually treat the core problems caused by this disorder. Because the cause of DPD is unknown, it makes it difficult to prevent the condition from developing. But treatment of DPD can sometimes allow a person who is prone to this disorder to learn more productive ways of dealing with situations. Many of the symptoms associated with this condition will decrease as treatment continues. Recognizing and treating symptoms early can prevent the condition from worsening. If you think someone you love might have DPD, it's important to encourage them to seek treatment before the condition worsens. Many people with dependent personality disorder don't seek out treatment until the disorder starts to significantly or otherwise impact their lives. If you or someone you know is in crisis, call the toll-free National Suicide Prevention Lifeline at 1-800-273-8255. It's 24 hours a day, 7 days a week. The service is available for everyone. The deaf and hard of hearing can contact the Lifeline via text at 1-800-799-4889. All calls are toll-free and confidential. Contact social media outlets directly if you are concerned about a friend's social media updates, or dial 911 in an emergency.